Hello! We made it! I'm sorry we're late. That is totally Steve's fault. Just letting you know. 100% Steve's fault. All his fault. I blame him entirely.
Yep, me too.
Who are you? When did you get here?
Wait, what? Which direction? I don't know where you are. I'm Bent Hovind. I am not related to Kent Hovind.
Probably.
I mean, I am, but not in the way he thinks.
Oh. So to him, you're like an elephant to his pine tree?
I don't care what he thinks about anything. Actually, that's not true. I do. Because I like going on Kent with Bent on Dapper Dino's channel every Tuesday night. Almost every Tuesday. So, yeah. That's where you'll see me. If you've seen me before, it's probably there.
So we're talking about nothing to do with Kent Hovind or evolution or any of that whatsoever. We're here to gross you out today. So if you have a weak stomach, if you faint easily, there's going to be a couple pictures that are medical pictures that might be pretty gross. So look out for that. You're a little bit uniquely able to talk about this, right?
Yeah, a little bit. I don't know a whole lot about maggot therapy, but I do work at a hospital in medicine. So I've been trained on how some things, to some degree, viruses and bacteria and all that stuff works. And I can talk a little bit about like the debridement and all the MRSA stuff. But yeah, I'm also going to be reading about it too as we go. But.
Very cool. All right, I'm going to share screens and we will take a look at what we got. Ba-da-da-da. You see that? Look at that. It's gross. Is that not disgusting? It's got us both on the screen there. There we go. Look at that. Just nasty ass.
That's gross, dude.
Isn't that like, what a picture, right? What a thing to start off with. Welcome to maggot therapy, which is what we're talking about today.
Yeah, that's a foot, right? Yeah.
Yes, I'm quite certain that is a foot. Yeah, diabetic foot. All right, maggot theory is a type of biotherapy involving the introduction of live disinfected maggots, fly larvae, into the non-healing skin and soft tissue wounds of a human or animal for the purpose of cleaning out the neurotic. Yeah, I said that right. I didn't say it. Neurotic. It's sleeping. The necrotic.
Well, necrosis is dead tissue.
Right.
So that's all it is.
Dead tissue within a wound and disinfection. There is evidence that maggot therapy may help with wound healing. Basically, it keeps your wounds clean out of dead skin and crap to keep it from getting infected. So essentially, when you're healing, correct me if I'm wrong, please. If you cut yourself and there's a bunch of dead skin inside the cut, it can heal over and cause infections and various problems.
Well, I mean, infections are really going to be caused by organisms, bacteria, fungus, virus, that kind of stuff. And you have those on your skin all the time. Your skin protects you, but if it's cut, you really want to get there and get all those germs out before they multiply and become pretty bad. Like, obviously, this nasty looking diabetic foot here, that's way far gone. You can't really do much about that.
Yeah, it's got a big hole in his foot.
And it's interesting, I don't know if we've gotten this far yet in the page, but it does talk about the enzymes that they release that are antibiotic in nature.
So maggot therapy improves healing in chronic ulcers, in diabetic foot ulcers. There is tentative evidence of benefit. Review of methods for the debridement of venous. That's not right. Venous. This is the veins. This is the vein thing. We talked about this off air.
We did talk about this, yeah.
Venous. Because I was really angry that this is the way this is spelt.
I'm not a language expert. I barely know English.
Right.
But I do know that, venous is from veins. So.
Yeah, venous leg ulcers found maggot therapy to be broadly as effective as most other methods, but also noted that the quality of data was poor. In 2004, the FDA cleared maggots from common green botfly, which is these little guys. You guys probably have seen these guys flying around. Puck eats them. For use as a medical device in the United States for the purposes of treatment of non-healing necrotic skin and soft tissue wounds, pressure ulcers, venous status ulcers, neuropathic foot ulcers, and non-healing traumatic or post-surgical wounds. So can you tell me what the difference between, like, what's a non-healing traumatic wound?
To me, that means like you got shot and you just never went to a hospital. And you've got a wound in your side or something. That's what I think when I think of because trauma is you fall off a ladder and your arm's sticking out. You know, it's that kind of stuff. And there are trauma events where people die. You know, like so obviously, but post-surgical wounds is obviously from surgeries that didn't heal well.
Mm.
You have to take care of your bandages the way your doctors and nurses tell you to.
Yeah, you should listen to your doctor.
They don't tell you that to bother you. They tell you that to keep you from dying.
They tell you it not for their own health, but for yours.
Yeah, it's crazy.
Limitations. The wound must be of a type which can benefit from the application of maggot theory. A moist... What does that say? Exudating? Ew!
Exudate.
Exudating, yeah. ING. A fluid emitted by an organism through pores or a wound, a process known as exuding, or exudation. Exudating, yeah. Is derived... Oh, I don't care about Latin. To ooze. Oozing. Exuding. A moist, exuding wound with sufficient oxygen supply and a prerequisite. It is a prerequisite. Yet the maggots need to be able to survive, I guess, right? Not all wounds are susceptible. Or are suitable. Oh my god. Wounds which are dry or open wounds of body cavities do not provide a good environment for maggots to feed. In some cases, it may be possible to make a dry wound suitable for larval therapy by moistening it with saline soaks applied for 48 hours. Ew! So it's like, hey, you've got a really dry wound, we're just gonna, like, put saline all over it. Do you want to explain to us what saline is, by the way? I think most people know, but I don't want to assume.
I actually don't know the exact formula. I'm pretty sure it's just like salt water, but I don't know if they...
But it's
exactly
just like...
how they make it.
It doesn't have anything in it, right?
Well, no. It's a very neutral fluid for adding other chemicals, like drugs, like for certain types of drugs that you need to inject in someone's bloodstream. Put it in an IV with saline. Do saline flush. Oh, now there's a patient who's in even more pain. The nurse will put the little fentanyl in and then saline to push it all through. So it's used in hospitals all the time.
Patients and doctors may find maggots distasteful, although studies have shown that this does not cause patients to refuse the offer of maggot therapy. Maggots can be enclosed in opaque polymer bags to hide them from sight. Dressings must be designed to prevent any maggot from escaping while allowing air to get to the maggots. Dressings are also designed to minimize the uncomfortable tickling sensation that the maggots often cause. The maggots are tickling the inside of my wound. My moist wound.
Just enjoy it, I guess. I don't know. That's gotta feel so weird, but...
I mean, depending on where it is, it could be more enjoyable than other places, right?
That's true.
A moist tickling sensation? What? Where are we? What's going on?
I don't know. Let's start back at the top.
So maggot theory. In maggot therapy, large numbers of small maggots consume a necrotic tissue far more precisely than it is possible in normal surgical operation, and can debride hopefully I pronounced that right, a wound in a day or two. The area of a wound's surface is typically increased with the use of maggots due to the undebrided surface not revealing the actual underlying size of the wound. They derive nutrients through a process known as extracorporeal digestion. Wow! By secreting a broad spectrum of, what is that?
Proteolytic.
Proteolytic?
Proteolytic.
Oh, proteolytic. Proteolytic enzymes. Please explain to me what a proteolytic enzyme is.
I can't tell you what that is. I have no idea what that is.
We don't know what this is!
No.
Nice. Let's find out.
Me.
Let's find out.
Enzymes in general lower the activation energy for proteins, but
I need to know. Why is it going to Bing? Why are you like this?
It's protease.
Alternative
It's an
titles.
enzyme that catalyzes proteolysis, the breakdown of proteins into smaller polypeptides or single amino acids.
Chain-like molecules. Neato.
Yeah, so it just makes the proteins break apart so that they can be smaller, and maybe form separate proteins.
And apparently it liquefies necrotic tissue and absorbs the semi-liquid results within a few days. In an optimum wound environment, maggots molt twice, increasing their length from 1 to 2 millimeters to 8 to 10 millimeters, and in girth within a period of 24 to 72 hours by ingesting necrotic tissue, leaving a clean wound free of necrotic tissue when they are removed. So essentially they excrete and reabsorb the stuff that they excreted. If I'm understanding correctly.
Not quite the way I eat food, but it works for them.
Gross!
Yeah.
Let's eat all this nasty stuff, excrete all this nasty stuff, and reabsorb all this nasty stuff, and double in size. Actually, they didn't get bigger than that. Double in size twice! Yeah!
But it is nice that those enzymes they release do fight off bacteria.
Yeah, that's super handy. It fights off bacteria, and they clean up after themselves. We should respect them more. Disinfection. Secretion from the magnets is believed to have a broad spectrum of antimicrobial activity. Can you tell I didn't study, like, medical anything? I don't know how any of these words are pronounced. Antimicrobial.
Yeah, I wouldn't worry about those.
That's all of them. Look at the next set of words. I don't know how to pronounce any of this shit.
Urea, phenylacetic acid, phenylacetaldehyde, calcium carbonate, proteolytic enzymes, and many others.
Hey! In vitro, studies have shown that maggots inhabit and destroy a wide range of pathogenic bacteria, including methicillin? Methicillin resistant, I don't know how to say that.
Staphylococcus aureus. So it's MRSA. They can destroy MRSA, the thing that is really hard to destroy.
Do we want to talk about what that is?
Well, if you ever have heard of a staph infection, it's probably MRSA. Most MRSA most Staphylococcus is not methicillin resistant, and I mean you've got it like in your nasal cavities and stuff like that. And it's just surviving at its temperature, not infecting you. It's like okay.
So it says
but
that
if you get a methicillin resistant Staph aureus. So yeah. I know a guy who I think he had like 7 or 8 surgeries on his knee to get rid of a staph infection.
That's a lot. This says MRSA's responsible for several difficult to treat infections in humans. And then it also says that it's common in hospitals, prisons, and nursing homes where people with open wounds, invasive devices such as catheters, and weakened immune systems are at great risk of hospital-acquired infection. MRSA began as a hospital-acquired infection, but has become community-acquired as well as livestock-acquired. The term MRSA, healthcare-associated, and community-associated and livestock-associated reflect this. So it's the one of the common factors in issues that you have when you have people who are ill, or people who are like, your bodily fluids are, outside of your body when they're not supposed to be outside of your body. When things get transferred really easily when you're treating different people in different places, and this became so common that it can be acquired either just by being in close proximity with people that have been injured, as well as if you're dealing with livestock at that point. And apparently maggots fuck that shit up. Yay! Well, which should explain why they would want to use them in hospitals and why they would want to use them instead of potentially other things, because it's going to be preventative for more issues down the line in difficult to treat infections. Very cool.
Well, I don't really know if my hospital I work at uses this or not. Like, I've never even considered that, so I'll have to see if I can
I know somebody who works as a nurse, and I was talking to them about this, and they told me that they've actually used maggots on more than one occasion, as well as used leeches, and they work in a hospital. They were using leeches because apparently leeches, when it comes to any kind of issues with, what did she say? She said that when blood gets, if there's any kind of like a disease that's going into the blood, or any kind of issue with it's going to go through the body, you've got some kind of virus, it's more likely to the virus tends to go to the thing that has the lowest circulatory system, so it'll go through the system faster, is what the virus wants to do. So if you put a leech right near the infected area, the leech will actually suck out the as it's sucking the blood, the virus will transfer into the leech because the leech has a smaller circulatory system, so it will actually go through the leech faster. I thought that was really interesting.
Yeah, I did not know that.
Yeah, so apparently viruses are like, they had priorities, and like, okay, well, I need to infect as much as possible, as quickly as possible, so they're likely to get caught in the leeches, because the leeches they're so small compared to us, especially, that our circulatory system, it takes X amount of time for the blood to circulate all the way through, whereas a leech is like in a minute. I don't know how long it is, but comparatively. That was really...
It's a lot quicker.
Right. Disinfection. That's where we're at. So, destroys a wide range of pathogenic bacteria, including MRSA. Group A and Group B, and gram-positive aerobic. Aerobic and anaerobic strains. Other bacteria like Pseudomonas.
I haven't heard of that. Aeruginosa, E. coli, or Proteus.
Ew. Oh, it stops E. coli? That's interesting. Are not attacked by maggots. No, they don't. Boo. They're not attacked by maggots, and in case of pneumonias, even the maggots are in danger. So yeah, they don't help you with pneumonia. Biology of maggots. Those flies whose larvae feed on dead animals will sometimes lay their eggs on the dead parts, necrotic or gangrenous tissue of living animals. The infestation by maggots of live animals is called myiasis. Ew, where it's underneath your skin. You know when they cut somebody open and like a bug comes out? You can see videos of that on YouTube. That's all over the place.
Ew.
I heard a story about a girl who had like this big ass like centipede thing growing in her head, and it was like between the skull and the edge of the skin. Some maggots will feed only on dead tissue, some only on live tissue, and some on live or dead tissue. The flies used most often for the purpose of maggot therapies are blowflies of the Calophyridae. Look at those big red eyes. Oh, Calophyridae?
Which
Can't
are
pronounce
from
shit.
the order Diptera, which has 1,200 species.
Known species.
That's
Oh,
true.
The blowfly species used most commonly is called the green fly, the common green bottle fly.
Yeah.
Look at this boy. Look at that boy. There's little
It's a cutie.
hairs. Yeah, go away. Where'd he go? There he is. Aw, look at his little hairs. Aw. Stop that. There we go. The common green bottlefly, another important species, is also whatever they're called, is also notable for its feeding secretions, which combat infection. That's this guy. Northern blowfly. These two guys. Written records have documented that maggots have been used since antiquity as a wound treatment. There are reports of the use of maggots for wound healing by Maya, Native Americans, and Aboriginal tribes in Australia. There have also been reports of the use of maggot treatment in Renaissance times. Military physicians have observed that soldiers whose wounds had become colonized with maggots experienced significantly less morbidity and mortality than soldiers whose wounds had not been colonized. These physicians included Napoleon's general surgeon, Baron Dominique Leray. I don't know if I pronounced that correctly. He reported during France's Egyptian campaign in Syria, 1798 to 1801, that certain species of flies consumed only dead tissue and helped wounds to heal. That's so cool. Could you imagine being the person, like, just noticing this? It just passively.
By the way,
like, you're operating on a guy, and you're gonna, like, it's gonna take you, like, 3 to 4 weeks to heal, and then we can start on the next procedure. Come and see me in a week. He comes, sees you in a week, he's got maggots in him, and you're like, well, you're healing faster than normal.
yeah. And then you're trying to tell other doctors, by the way, and hear me out on this one. So,
Just, like, over
maggots,
drinks.
right?
Have you guys noticed the maggots growing? Yeah, so I got Dave over there. And, sorry, they're French. Le Dave over there. He's got this kind of maggot in him. And I got Steve over there with this kind of maggot in him. And I got Jimmy over there. Jimmy ain't got no maggots. And Dave's getting his leg, like, he's done. Like, he's dead. But Steve over there is healing faster than Jimmy is. And Jimmy's probably never going to walk again because it's taking too long. But maybe if I had given Jimmy the maggots, he might have been able to walk. Feel bad for Dave, though.
Yeah, he does come.
Joseph Jones, a ranking Confederate medical officer during the American Civil War, is quoted as follows, quote, "I have frequently seen neglected wounds filled with maggots. As far as my experience extends, those worms eat only dead tissue and do not injure specifically the well parts," end quote. The first documented therapeutic use of maggots in the United States is credited to a second Confederate medical officer, Dr. J.F. Zacharias, who reported. I always question if I'm pronouncing something right, especially when it's a last name. I'm like, that's how I would say it as a first name, but is that right as a last name? Who reported that during the American Civil War that, quote, maggots, ... in a single day would clean a wound much better than any agents we had at our command, ... I am sure I saved many lives by their use, end quote. He recorded a high survival rate in patients he treated with maggots. Interestingly enough, it does seem that these kinds of things tend to come out of necessity. Like, both of these things are either from war or, like, noticed during wars or noticed during times when there were no other options.
just accidental. He just found it. They couldn't treat soldiers quick enough, I guess. So, neglected wounds and those maggots.
Yeah,
and now it's healing.
And the flies are already known to lay eggs in living animals, living creatures. Ash Key for $2.99 says, "Rockin', hell yeah, flies are metal." It kind of makes it a situation where they're not going to be able to get to them and get everything cleaned up, so the flies are likely to come over, and turns out they were helpful. During World War I, William S. Baer, an orthopedic surgeon, noticed that a soldier left for several days on the battlefield who had sustained compound fractures of the femur, a large flesh wound, and arrived at the hospital with maggots infesting his wounds, had no fever or other signs of infection, and survived his injuries, which normally would have been fatal. After the war, Baer began using maggot therapy at Boston Children's Hospital in Massachusetts. Wait, he started using it in a children's hospital? What a dick! Let's test it on the children. What an asshole! So, yeah, you're right. He came across it entirely by accident. This guy did, at least.
Yeah, well, it's cool.
It pays to be observant, but also it pays to find things that are beneficial in times that are like so horrendous for the people involved. But why would you go from, oh hey, I saw this guy on the battlefield and he survived this thing, let's try it on kids?
You gotta save the kids first, right?
So. Right. Save it. Think of the children. We have to save the children. Let's throw maggots on them. There were reports that American prisoners of war in the Japanese in World War II resorted to maggot therapy to treat severe wounds. A survey of the U.S. Army doctors published in 2013 found that 10% of them had used maggot therapy. Regulations. In January 2004, the U.S. Food and Drug Administration, FDA, granted permission to produce and market maggots for use in human or animal as a prescription-only medical device for the following indications. Quote, for debriding, for doing the thing, non-healing necrotic skin and soft tissue wounds, including pressure ulcers, venous stasis ulcers, neuropathic foot ulcers, and non-healing traumatic or post-surgical wounds. So, what would a post-surgical wound kind of be? Would that be instead of using stitches, what would that? I dropped my knife. Oops. I'm assuming that's not the case.
I don't know. It might be a wound that's so large that there's still a wound after they do surgery. It could mean something else. So I'd have to read about it.
Heavens for 5 said instead of a sneak attack of pocket sand, it's pocket maggots. I mean, it could be. Okay, if you wanted to do something gross in D&D and you have a character who is either an undead or a character that heals relatively, isn't going to be bothered by a flesh wound of some kind that is festering, you could slice a part of your leg open and stitch a flesh pocket. And so just constantly have scabs in there and just breed your own maggots inside your little flesh pocket and throw them at people. I think I would give you points for intimidation. If you were trying to intimidate somebody into listening to you and you were like, hey, listen, I need to know this information. I need to know where this guy is. And you reach into your ass pocket and whip out some maggots and you just start munching on them. Guasa for 10 says, I'm aware that maggot therapy does have some applications, but I'm not sure why modern medicine would prefer it over currently existing methods of treatment. What do you think?
Well, I don't know if they do or how much they do. I mean, in 2013, 10% of U.S. Army doctors had, so some people use it. But as far as I can tell, if it's really good at eating just dead tissue and none of the living tissue, it's probably better than doctors are at that. It's really hard to cut out a tumor in someone and make sure you get all of the tumor cells out and leave as much of a patient's body left as you can. They usually have to go beyond the mark. I mean, I'm not an expert on exactly what they do, but my understanding, which could be wrong, is that they have to go a little bit beyond the margins of the tumor so that they make sure they get all of the tumor. Because if you leave any tumor left, guess what happens? It keeps growing until it's a big mess again. So,
and Dapper makes a good point too, that if it's good at preventing MRSA, that most other things are not able to do, then it might not guarantee that you won't get some kind of infection, but it's preventative and more likely to help you, then that would be a very good reason why you might prefer it. Plus, some doctors will prefer things that are a little bit more naturalistic or that don't use as much, aren't necessarily as wasteful or don't use as much of a product when they don't need to. Or there may be a price issue. It could be that your patient can't afford one thing or the other, so they'll give them the thing that they can afford. Maggots may or may not be cheaper. So the hospital also may be like, hey, use this. The hospital itself might be like, hey, we're cutting corners on this thing, so use maggots instead of this thing. If we don't have to order more, that's great. Inventory. It could be an inventory issue. Hey, we ran out. Throw some maggots on it. If anybody thinks that a hospital, when it comes to inventory, operates any differently than like a fast food chain, you're wrong.
So it is debriding, by the way. And,
it is debriding?
Post-surgical wounds are anything from after surgery. They cut you open, they got to seal you back up. Mm-hmm. And if your stitches get infected in that area or whatever, and the infection grows too quickly or whatever, maybe they'll use maggot therapy for it.
Gotcha. Very cool. So
if they tell you to wash your whatever, or leave it alone, or don't shower, or whatever, listen to them.
Yeah, do what your doctor tells you to do. Veterinary use. The use of maggots to clean dead tissue from animal wounds is part of folk medicine in many parts of the world. It is particularly helpful with chronic, infection of the bone. Its symptoms may
osteomyelitis. I hate osteomyelitis.
Okay, tell me.
Osteomyelitis is awful.
Tell me about it.
Osteomyelitis is, it's just an infection in your bone.
That sounds awful.
I'm pretty sure it hurts a lot, and I'm pretty sure. So, the real reason I hate it, though, is because when I get called to a bone biopsy, and I say, is it osteomyelitis? And they're like, no, it's not. And I'm like, all right. And then I say, I don't see anything except normal bone. And they're like, oh, yeah, we think it's osteomyelitis. And I say, okay, see you later. And I walk away. Because I can't help with osteomyelitis. It's not the kind of thing I can possibly diagnose. Or any pathologist in the world, based on the stains that I'm using, they cannot do it. Or at least that's how it's done at our hospital. So
it's frustrating for you.
So they just drilled. Well, it's frustrating for me because it wastes my time. But they just drilled into someone's bone one time, and now they can't do it again depending on the size of it. And then they gave it to me, and I ruined everything. The whole sample's ruined. It's not sterile anymore.
Right.
It's not. So all that stuff. Okay, well, send the patient home and bring it back in a month. And hopefully whatever it is isn't getting worse. All because one person didn't call the right expert. Didn't answer my questions correctly. That happens all the time. So that's why I hate it the most.
So the symptoms may include pain in a specific bone with overlying redness, fever, and weakness. Long bones of the arm and legs are most commonly involved in children, while feet and spine and hips are most commonly involved in adults. So, hey, if you're ever getting weird pain and you think it's coming from your bones, go to a doctor.
That's pretty great.
Particularly helpful with chronic ulcers and other pus-producing infections that are frequently caused by chafing due to work equipment. Maggot therapy for horses. So yeah, we're talking about, please keep in mind, when we're talking about chafing due to work equipment, we're talking about veterinary uses. So like, you're not getting it from your hard hat. This is like if you're a dog that's wearing a harness a lot, or if you're a horse and you've got like a bridle on and it's like pulling on your face, shit like that. Take care of your animals. But accidents happen, and sometimes moisture gets in equipment and causes it to chafe a little bit more than you would normally expect, and take care of your animals. Maggot therapy for horses in the United States was reintroduced after a study published in 2003 by veterinarian Dr. Scott Morrison. This therapy is used in horses for conditions such as what we talked about, and secondly to whatever this is. Lamentitis?
Laminitis. It's an infection of the lamin. I don't know what that is, actually. But itis means infection. If you didn't know, itis means infection, everyone.
Hey!
That's a foot tenderness? Well, if it's not by an infection, then I've been lied to. Osteomyelitis is infection of the bone, yeah, so... Subsolar
abscesses. Oh, abscesses. Like the plural of abscessed.
Abscess is, yeah, it's basically a bunch of acute inflammation and probably a lot of dead bacteria, and it's kind of sealed in some kind of what do they call it now? I can't think of the term. Well, they're sealed anyway, so...
Does subsolar mean it's open, like below the skin?
Oh, where is it? Subsolar? I don't know what subsolar is.
I clicked the button. No. Whee! Going back. Sorry. Subsolar abscesses. Abscesses.
I feel like these are just bones that humans don't have.
Oh, yeah, that could be.
Well, subsolar is in the foot, I guess, but it does say it's for horses, so yeah.
Post-surgical treatment of street nail procedure for puncture wounds infecting the navicular bursa, canker, non-healing ulcer on the frog. Like an actual frog? Oh no, the frog is a part of a horse's foot located on the underside, which should touch the ground if the horse is standing on soft footing. The frog is triangular in shape and extends midway from heels towards the toe, covering around 25% of the bottom of the hoof. So basically, you can use maggots anytime you're doing any kind of even maintenance on your horse's giant toenail. And a post-surgical site cleaning. However, there have not been many cases of studies done with maggot therapy on animals, and as such, it can be difficult to accurately assess how successful it is. So it seems in totality that this is, so far, has been successful, but is only semi-popular in some circumstances. And there isn't enough, like, consistent data to make any kind of broad claims that no, this is 100% good, or this should necessarily be used in any certain case, if I'm understanding the Wikipedia article.
Well, it is approved by the FDA, though, and that includes for animals, prescription only. So there has to be some kind of scientific backing to it for the FDA to approve it.
Yeah, it
you
looks
would
like...
think, or you would hope at least.
A lot of the further reading has a little bit more about, like, the studies that are done, like maggot excretions and secretions, and what they do. This one's about treating diabetic foot ulcers specifically, maggot therapy for the treatment, intractable wounds, microbiology reviews, wound microbiology and associated approaches with wound management. So it seems like it's consistently something that will work. It's up to the discretion of the doctor and the hospital to decide whether, and probably where you are in the world. Can these maggots ever hatch into flies? I assume so.
Oh yeah.
That's why you take them out
Yeah.
after 48 hours.
Well, yeah. You know what? Just let them hatch. They'll fly away on their own.
I imagine that as soon as they become flies, though, they start leaving a mess behind for more maggots to clean up that you don't want to have to deal with.
It's possible, but then the new maggots would just take care of it, so...
Presumably. Is there anything to be said for flies being a little bit less disgusting of creatures than we think they are? Or than we might assume that they are?
I will not comment on that. I'm not going to give flies any more credit. They're not mosquitoes. They don't spread malaria. But as far as I know, I don't know how safe flies are for spreading disease. Like, I try not to eat them also because they're gross.
I mean, I would assume that they would spread things relatively easy because they're going from one dead body to another dead body. But and then again, so do butterflies. Like, butterflies eat corpses. But we don't tend to be concerned if a butterfly lands on our face. We're like, oh, look, a butterfly landed on my face. If a fly lands on your face, you're like, oh god, get it off of me.
Right, yeah, they're disgusting.
Right, so like we view one way and one the other way, and we're very, very biased on like the visual appeal of whatever it is that's coming at us.
That we are, and I think we should be, honestly.
I think that's a
We've
little bit
evolved
fair.
that way, why not stick with it?
Gee, I don't know. I don't know, man.
But if I ever get maggot therapy, I'd be okay with it.
We got Kawasa for 2 said they're Beelzebub, they're evil. Abaddon, Abaddon. Those are the locusts. Alright, that's our 45-minute mark. We actually managed to keep the time down. We did want to not go down too many rabbit holes and wanted to keep this one short because, 1, we didn't want to gross everybody out too much, but 2, Steve started late and it's all his fault anyway, so blame Steve.
Thanks, Steve.
Thanks for coming. I hope you come back again sometime and maybe we can spend a little bit longer on whatever it is that we're discussing, but I learned things. Yeah. Did you learn things?
Oh, yeah.
I hope the audience learned things.
I sure did. So, yeah, it was a lot of fun. Thanks for having me, and we'll see you next time.
Nice. Next time we'll have ourselves a little bit of a longer sesh. We'll see you guys later.
Yeah.
Bye.
Ba-da-da-da-da-da-da-da-da-da-da-da.